Coming up, I'll show you why cheap leads can become the most expensive patients that you'll never acquire. The filter before traffic framework. 3 steps to attract serious prospects, repel price shoppers, and stop wasting consultations on people who were really never ready to buy. In This Week in AI, I'll show you how to give Claude a reoccurring assignment that runs automatically every week. In The Pulse, scientists have now given the first human patient an experimental therapy designed to make aging cells behave younger. Some are already calling it the age-reversing injection. In Ask Dr. Ross, my ads are generating lots of leads, but too many never show up. What am I doing wrong? The answer may make your media buyer uncomfortable. Good, they can take it up with their dashboard. So let's get into it.
From the studio in West Palm Beach, Florida, this is the Practice Growth Show with Dr. Ross Carter. Your weekly source for smarter strategies, better systems, and real results for health providers ready to attract better patients and build a more profitable practice.
Welcome, I'm Dr. Ross Carter, and I am glad you're here. I keep meeting providers who are kind of proud of their lead count and then quietly miserable about their close rate. More form submissions, more phone numbers, more appointments on the calendar, but also more no-shows, more price shoppers, more wasted staff time, and less revenue than expected. The provider says, hey, we generated 100 leads. The staff says, yes, but about 82 of them have apparently entered witness protection. That's not always a lead generation problem. It's often a lead quality problem. Today, we are going to attract fewer of the wrong patients and more prospects who value your approach and are prepared to act. So let's go. The growth lesson. More leads can make the problem worse. Here's the truth that nobody will hear at a marketing conference. You may not need more leads. You may need better prospects. Most providers watch cost per lead, clicks, form submissions, and appointments booked. Those numbers look excellent on a report. Unfortunately, your landlord still refuses to accept impressions as rent. The numbers that matter are qualifications, show rate, close rate, and revenue. Imagine one campaign generates 100 leads, 30 answer the phone, 10 book an appointment, 5 show, and then only 1 becomes a patient. Now another campaign generates, say, 20 leads, 15 answer, 12 book, 10 show, and 4 become paying patients. Now the second campaign may have a higher cost per lead, but it has a much lower cost per paid patient. And unless you recently opened a lead museum, the paying patient is the point of the whole program. The problem gets worse when providers assume volume will repair weak results. If 100 leads produces only 1 patient, then 1,000 leads should produce 10. Mathematically, perhaps. However, operationally, you may need a new front desk by Thursday. Scaling weak lead quality magnifies the problem. The real issue is usually confusion about who you want, what makes your offer different, and what the prospect must believe before booking. A vague message invites everyone. The bargain hunters, the person wanting free advice, the person who felt tired yesterday because they stayed up till 2 in the morning, and the serious prospect who has spent 2 years exhausted and being told everything looks normal. They all enter through the same door, and your team has to determine who belongs there. That's not marketing, that's a triage. Consider the typical hormone advertisement. Something like, are you tired all the time? Schedule your free consultation today. That could attract anyone who's had a bad night's sleep. Now compare it with if your energy has continued to decline despite you're getting enough sleep, you're taking all the supplements you need, you've maybe changed your diet, or you've been told that your blood work is normal. It may be time to look at how your hormones, your metabolism, your stress response, your sleep are all working together. That message acknowledges failed attempts, recognizes frustrations, and introduces a more complete explanation. Now, that is not automatically a failure. Strong marketing helps the right person say, That's exactly what I've been experiencing. And it helps the wrong person just keep scrolling. Your marketing should not only attract, it should filter. Here is the principle: clarity before traffic. The practice tool. The filter before traffic framework. Here is a framework you can use in your next ad, video, or landing page. It has 3 moves. Move number 1, name the specific fit. Do not begin with a broad symptom. Describe the situation of the person you actually want. For example, this is for adults over 40 whose energy, sleep, weight, or mental clarity have continued to decline despite changing their diet, trying supplements, or being told that nothing is significantly wrong. Now, the casual prospect thinks, this may be more than I need. The right prospect says, finally, someone understands why I'm so frustrated. Move number 2, educate before you invite. Most providers ask for the appointment too early. A stranger sees one ad and immediately gets booked now, but a prospect still has questions. Why should they trust you? Why is your approach different? Why did the things I've already tried fail? Am I a candidate? Is this just another person trying to sell me some more hormones? Those questions do not simply disappear because someone completed a form. Before asking for the appointment, explain why fatigue may have multiple causes and how your evaluation works and who may or may not be appropriate. When prospects see that first, the consultation is going to change. So let me explain what we do. You begin with, what questions do you have after watching the explanation? Move number 3, qualify inside the funnel. Do not wait until the consultation to discover whether someone's serious. Ask questions like, how long has this problem existed? How does this affect your quality of life? What have they already tried? Why are they seeking help now? Are they prepared to invest in care that they may not be covered by insurance? You need enough information to distinguish someone seeking a solution from someone just clicked because your ad interrupted a cat video. So here's your action step. Open your current ad or your landing page. Add 1 sentence identifying exactly who the offer is for. Then add 1 sentence explaining what it's not. For example, our evaluation is designed for adults with persistent symptoms who want to understand the larger pattern, not for someone who is looking for a quick prescription or another supplement. That does not make your funnel smaller, it makes it smarter. For the fill-in-the-blank framework, go to practicegrowthinsider.com, and there you can download the free Practice Growth Starter Kit. Now, let's give AI a reoccurring job. This week in AI, give Claude a job, not just a question. Most people still use AI like a search box. They ask a question, they receive an answer. Claude now allows scheduled tasks through Claude Cowork. You describe the assignment once, choose when it should run, and Claude can repeat it automatically, daily, weekly, monthly, or on demand. It can deliver a completed briefing, summary, and a report instead of waiting for you to restart the process every time. This is different from a reminder. A reminder says, hey Ross, remember to do some research on healthcare news. Why, thanks. That was almost useful. A scheduled task can perform the research.
So let me show you how to do this. You have to do this with the desktop app and not regular Claude. Go to this website, claude.com/download. Then download the desktop application. Once you have started the app, you will see a page like this. Click on Scheduled, click New Task.
Every Monday morning, research the 5 most important developments from the previous 7 days in regenerative medicine, longevity, hormones, peptides, and even private healthcare. Use primary sources when possible. For each story, include the original source, a short explanation, and why it matters to providers, and 1 patient-friendly context idea. Exclude rumors or anything that cannot be verified. Now Claude has a reoccurring responsibility. Every Monday, you start with a briefing instead of 14 browser tabs. You can also schedule a content plan, a team briefing, marketing reports, competitors' reviews, or initial research for a show like The Pulse. Here's where most people get it wrong. They will schedule, send me healthcare news every Monday. And every Monday they'll receive a professionally formatted pile of information they cannot use. Automating a vague instructions do not improve the instructions. It simply guarantees that vague results arrive on time. A strong scheduled task defines the research topic trusted sources, time period, audience, output, format, and what to do when something cannot be verified. A question asks for information. A job defines responsibility. Now there's two cautions. Scheduled tasks do not mean accurate. You still own every medical claim, statistic, and recommendation published under your name. And limit what files, apps, and information the system can access. Start with public research, content planning, de-identified business information, and general reports. Your action set. Choose one important task that should happen every week because usually it doesn't happen because no one owns it. Give Claude that job on a schedule. Now for the pulse. Has a reverse aging therapy entered human testing? On June 9th, 2026, Life Biosciences announced that the first participant has been dosed in a phase 1 trial of ER100. Some headlines are already calling it the first reverse aging injection given to a human. That sounds exciting. It also leaves out important details. ER100 is an experimental gene therapy using partial epigenetic reprogramming. It uses three factors commonly called OSC, OCT4, SOX2, and KLF4. But it is not a full-body anti-aging injection. The therapy was delivered into the eye. The study involves optic neuropathies, including open-angle glaucoma. The primary purpose of this early trial is to evaluate safety and tolerability, with additional measures examining visual function. One patient receiving an experimental treatment does not prove that human aging has been reversed. It means partial epigenetic reprogramming has entered human clinical testing. And that is still significant. Patients will see the headlines, and some will walk into longevity practices asking, hey, when can I get my reverse aging shot? That gives the informed provider an opportunity. Do not dismiss the science or exaggerate it. Explain what happened and what has not yet been proven. Patients are going to need someone who can separate scientific possibility from clinical proof, and that is the pulse. Today in Ask Dr. Ross. Dr. Ross, my ads generate plenty of leads, but almost nobody is showing up. What am I doing wrong? Here is the better question. What did the prospects see before I asked them to book? A click is going to mean, hey, you caught my attention. A form submission means, hey, I'm kind of curious. Show-ups require, this provider understands my problem and this appointment may be worth my time. See, clicks are curiosity. Shows are more conviction. Look at the journey before the appointment. Did the prospect see why previous attempts may not have worked? How your evaluation differs? Who you help? And what happens next? Tired after 40? Balance your hormones. Free consultation. Click here. If that is the entire journey, you did not create conviction. You reduced a complicated concern to a slogan and attached it to a calendar link. Before demanding another 300 leads from your marketing company, fix the education. Send the prospects one video explaining the problem, one showing your process, one answering their main fears, and one clear explanation of what happens next. When people understand the appointment, they value it. When they value it, they are going to most likely show up. And if you have a question, please send it to questions@practicegrowthshow.com. Now for the final word. Here's the thought I will leave you with. Stop asking how to generate more leads. Ask whether the right prospects can tell before contacting you that you are the right provider, and whether the wrong prospects can tell as clearly that the offer is not for them. That's not really a smaller funnel. That is a smarter funnel. Clarity before traffic, education before invitation, qualification before consultation. More leads do not repair a confusing message. They simply spread the confusion faster. Now, subscribe to the Practice Growth Show so you do not miss the next episode. Go to thepracticegrowthinsider.com and there you can download our free Practice Growth Starter Kit and watch all the episodes. And send this episode to a provider who proudly announces how many leads they generated, but then kind of changes the subject when you ask how many actually became patients. They will know exactly why you thought of them. Remember, you do not need everyone to respond. You need the right prospects to recognize that you are the right provider. I'm Dr. Ross Carter. I'll see you next week.